Well, Canada doesn't come off looking too good on the economic front, its handling of the COVID crisis. Our GDP fell by more than average. For example, we contracted by 13% at the worst of the pandemic, compared with only 10% in the US. And our unemployment rate increase was almost double what the OECD average was. And all of this was at the cost of the largest increase in government deficits of any G7 country. So we pretty much had, subpar performance on all accounts in terms of income loss, job loss, and debt increases. And just to add in a little extra pain at the end, we've also had one of the largest housing price increases as a result of low interest rates. So we haven't fared well on the economic front at all. Well, if it did, it probably wasn't very efficient. As I said, we had a huge increase in our deficits and just a slightly better than average response in terms of our debts, large because we were better in the US and pretty much everybody was better in the US without trying very hard. It's also arguable whether the decrease in deaths in Canada is just because of spending money. We know, for example, that if we just adopted better policies, such as, for example, not allowing people to circulate too much in and out of old folks' homes, that without spending any money, you could substantially reduce the death count. And death count was very much concentrated amongst people over 65. So that's where we should have concentrated. And that's a theme we'll be coming back to throughout this examination, how Canada responded is we didn't do a very good job of targeting, whether it was in terms of healthcare measures or in terms of economic benefits or even in terms of lockdowns. And that's why there was a lot of wasted effort in Canada's response and why we didn't get a lot of bang for our buck. Well, yes, and what started out as an income replacement measure, which was in most European countries, for example, they designed programs to replace, but only replace income lost. We ended up substantially adding to incomes. And the proof that was this, a lot of this went to households that didn't need it, was that we saw a very substantial increase in the savings rate. So people weren't using this to keep a roof over their head or put food on the table. They were using this to well, they didn't need the money to spend for everyday items, so they ended up investing it. We saw a lot of money went into personal savings accounts. A lot of money appeared to work its way into the stock market and housing markets as well. And that certainly was not the intent of government. So what we needed to do was to do more like Europeans in targeting this money only at people who needed it. For example, we've seen studies that have shown that 750,000 teenagers in this country ended up getting served. These people were living at home, they were not destitute. This was not the intention of income replacement policies. So again, we needed to do a much better job of targeting this to people who truly needed it. And we could have done a better job, like the Americans did, of funneling this through businesses and not make it a direct government to household transfer, but funnel it through businesses to their employees and keep that connection between employees and their firm that hopefully we'll be able to reestablish as soon as the economy reopens. Well, what the MLI index showed was that Canada fell down on two fronts. It didn't have a very good response, and it didn't have very effective economic outcomes. And I think both actually were symptomatic of the same thing, that there was a lack of good targeting. For example, we saw in a lot of Asian countries they were able, because they did extensive testing, they, instead of closing down whole cities as Canada did, they would close down a firm or a neighborhood at a time. And then they would test within that neighborhood and make sure that the proper people were quarantined. But they didn't go for these blanket lockdowns. Whereas in Canada, for example, our largest city, Toronto, has now been locked down for over 100 days, one of the longest lockdowns anywhere in the world. This is our economic hub, and it's been hobbling along on, at best, one leg for 100 days now. So that just shows how not very precise targeting and instead having these blanket lockdowns didn't do a good job. Similarly with the economic costs, as we just discussed with CERB, we sent CERB out to anybody. Basically, anybody applied. It was just come and get your $2,000 a month. Whereas, so we did protect people's incomes, but we did it at an enormous cost in terms of our deficits. If we had done a better job of targeting this precisely at specific households, we could have reduced the cost. So I think something that to be learned from the MLI index is that we didn't do very well because we didn't do a very good job of targeting programs. You might forgive that at the start. You know, this was new for everybody. Nobody knew how to handle the pandemic. Everybody was in a panic. But even as we moved along, we didn't learn from the best practices of other countries and refined and adapt our programs. It was like that once we adopted programs like CERB or like citywide lockdowns, we got locked into that as if that was the only possible response. And so we didn't do a very good job initially or even of adapting our response as it moved along. Well, Canada's had this image. We had a very good decade in the decade of the 2000s. We're on the cover of The Economist as cool Canada. We survived the great financial crisis very well. We had the soundest banking system in the world. Our prime minister was touting us as an energy superpower. I mean, we seem to be on a roll in a lot of ways. And I think this pandemic has highlighted that there's a real sense of malaise in this country, that the last few years we seem to have gone off track. I think the pandemic highlights the shortcomings in our healthcare system. Canadians have always really identified closely with the strength of our healthcare system as one of our greatest symbols. And it turns out, as we sit here and we watch Americans getting vaccinated left and right, that we have some shortcomings in our healthcare system, and not just the way we took care of old people, but we weren't able to innovate the way the Americans were. We weren't able to acquire vaccines. Instead of Canada is back, Canada is back of the line. But even there, there have been some, the the public sector failings have been evident for some time. But what's really worrisome is that Canada isn't doing well in terms of private sector firms. The Financial Times compiles an annual list of the 100 best corporations in the world. Canada has one entry, Shopify. A lot of other small countries like Australia and Sweden and so on have at least two or more. So it's not just a question of size. We used to have world-beating firms like Nortel, like JDS Uniphase. Bombardier had a worldwide footprint at one point. And they've fallen by the wayside, and we haven't had anybody come along to replace them. And I think that's what really concerns me going forward. Public sector competence comes and goes, but when you lose your private sector edge, you're losing your ability to create incomes, you're losing your ability to innovate. And that's something that suggests that there's something more pernicious at work here that's going to be much more difficult for policy to fix in the long term.